Following on from the previous lecture, we will now look at some of the data considerations that you may want to look at when developing these kind of systems. So, as an overview of what we'll go through in the next 20 minutes, first of all, just a very quick overview of the understanding of the temperature and health impacts relationship. And then we will move on to some of the differences that you may want to consider when it comes to operational aspects of that. So thinking about going from academic epidemiological studies through to how you might, or what you might want to think about in terms of operationalizing those. So we'll look at mortality, morbidity, and then these external factors or subjective impacts. So these are things that maybe influence some of the health outcomes that we might observe. And we'll go into that in a little more detail later. And then we'll just touch briefly on the exposure metrics, and then finally a quick discussion around spatial resolution. So first thing we need to understand is the relationship between temperature and health impacts. So we know that health impacts are typically observed or seen within 0 to 1 days from the onset of high temperatures. So this chart, you can see an example of that. So this is from the Heatwave mortality report from summer 2019 from England. And the green line here shows the central England temperature, which is a composite index of temperature across England. And the green line represents the daily mortality of the 65 plus age group. And as you can see, as the temperature increases, the daily mortality increases in line with that. And this is circled here in the chart. So this was a period where England observed its highest temperature on record, and much of Europe was also experiencing sort of the warmest temperatures they've seen. But it's not just about mortality. So this chart again is from the same period in England and is taken from Public Health England's Emergency Department Syndromic Surveillance System. And it's looking at emergency admissions for heat and sunstroke over that same period, as I mentioned. So again, we see a sharp peak in admissions as the temperatures increased and peaked in July. And again, this is circled. However, the scale on the y-axis indicates actually that the percentage of all emergency admissions for heat and sunstroke is actually really quite small. So I think the peak doesn't quite even get up to 0.4%. So, there is a question about the actual sensitivity of these systems. But this is great. This and the previous slide, great for showing or observing episodic spikes in the health impacts. But in terms of understanding the relationships between temperature and health impacts, we need another approach. So a common approach is to perform a time series analysis of daily all-cause mortality or specific morbidity data and temperature. So distributed lag, nonlinear model or linear model are common epidemiological approaches in the area of heat and health, and incidentally cold and health. And these can describe the relationship for us. So these two examples show this type of output, and this type of output is useful for influencing the operational thresholds for action. I won't go into the methods for this here because they are available elsewhere, but it's worth bearing in mind these are good approaches to understanding this relationship. So I guess from here, how do you go from this pure epidemiological or academic study to actual operational use? And as I mentioned at the start, there may be other factors at play that you need to consider. So we'll go through some of the potential impact data considerations, so starting with mortality. And I think from from our experience, two real key questions we ask ourselves the whole way through this is what data is available and how useful will it be? So I mentioned linear and nonlinear models. So there's a question about which one of those to use. Does it matter? What is available, and do they actually make sense? So, for example, if you're looking at different regions within the same country, the relationship might be slightly different, and depending on what approach you go with, either linear or nonlinear, do they actually make sense in terms of when you start to see the increase in risk start to increase as temperature increases? Another consideration is nighttime temperatures. So we know that respite from high overnight temperatures appears to play an important role. Evidence from the UK and London specifically suggests that high nighttime temperatures are particularly important in the 0 to 65 age group. And what about age-adjusted relationships? Again, we know that older people with pre-existing conditions are more vulnerable than the younger working age population. Therefore, should any analysis of mortality for setting thresholds be only on the higher age groups? And what would the utility of that be for the end user? So again, coming back to how useful it will be. And then there's also a question about seasonal thresholds. So we know that heat episodes that occur towards the beginning of the season tend to show higher impacts than those that occur towards the end of the season. So this raises a question of whether we should conduct these type of analysis for different time points throughout the season. So looking at monthly relationships or quarterly relationships and thus thresholds. But then there are operational concerns with that. If you were to set monthly thresholds, you could end up with a step change in thresholds at the end of every month. And how would you go about actually explaining that and communicating that? In terms of morbidity, so we know it's not just about mortality, but how, again, we come back to this, how useful will adding morbidity be? So some of these on the slide are just examples of potential data sets or potential areas you could look at. But one sort of question that has been raised when we've looked at this is how sensitive is the data actually to the temperature? So, for example, is there a clear relationship between increased risk of ill health or system usage as the temperature increases? And if the systems or the data sets aren't actually that sensitive, for example, a risk of admissions at 20 degrees only increases by like 2% by the time it gets to 30 degrees, how useful and how significant is that increase? So what would you expect the end users to do about that? So I don't have any answers. These are just sort of questions that when looking at the data or at data you potentially might use, these are questions you might want to ask yourself. So there are then perhaps some criteria that will be vitally important to any warning system that you may not be able to quantify. And these factors may depend completely on expert and professional judgment and experience. Experience in the UK, has taught us that having rigid thresholds in place may lead to situations where temperatures are hovering just around or just below a learning threshold, and therefore no warning was actually issued. However, due to some of the issues on the slide, we may have actually wanted to issue a warning, and when reviewing the data, that may back up that sort of reflective thought. So I guess with this sort of the external or subjective impacts, it kind of brings us back to the first lecture, and the flexibility in warnings and decisions for issuing warnings. And they're important to consider. So it's probably worth understanding these other external or subjective factors, and how they might interact with any alert or warning and decision making for issuing those. Um, and yeah, because it's all about decision making, and these external or subjective factors are you need to consider them, and consider how they actually may help you in your decision-making process. So a good example of that right now is COVID-19. We know that some of the vulnerabilities from heat and COVID-19 overlap. So there's this extra almost sensitivity around all of this. So how will our knowledge of this and our understanding of where the disease is within the population, how will that actually influence our decision making when issuing an alert? So moving on to exposures. So this is an important consideration, as any threshold will be dependent on the exposure you choose in your analysis. And there may be some communication issues related to your choice. So for example, average temperature might be the best epidemiological predictor of mortality, but how might you explain your thresholds if the weather forecasts are giving the public the maximum temperature and minimum temperatures? And I guess it's really about professional judgment and keeping in line with other systems that might be in place. Another question is around temperature and humidity. So does humidity actually play a role? This is an epidemiological question, and probably requires some further research and analysis. But if I again come back to a UK sort of perspective, we have evidence that suggests humidity doesn't really play that big a role and doesn't really improve the predictive power of the analysis. However, it may play a role in some regions where the humidity levels fluctuate, or where humidity levels actually inhibit the body's ability to cool itself. And then there are these other metrics, so feels like temperature, and there are a whole host of others. And again, it comes back to the question that I kind of made bold for the impacts: is the data available and is it usable? So there are a number of considerations around geographic resolution beyond just the resolution of your warning. You may want to issue warnings by areas of interest, or you may want to issue them by administrative boundaries. So I've got some examples here like that. So I've got contours, which is essentially areas of interest. And this is taken directly from the National Severe Weather Warning Service from the Met Office in the UK Met Office. And then we have here two examples of administrative boundaries. So we have here regions, which is taken from the English Heat Health Watch system. And then we have the Sustainable Transformation Partnerships, which is just another example of sort of administrative boundaries. And so, actually deciding how you want to issue these alerts are one thing you may want to consider. But these might also be influenced by some of the data considerations. So, for example, what resolution was your exposure and impact data in? So you may have to aggregate some of your data. So how will you do this? For example, if your temperature data is at point level or is gridded, but your health data is at a much larger resolution, how do you aggregate your exposure data up and make sure that your exposure is actually appropriate for that geographical resolution. Another consideration is, how much of these areas actually might need to breach your thresholds for an issue, in order to issue a warning. Is it 10%? Is it 1%? Is it 50%? Is there a way to decide this, or is it, again, professional judgment? Another potential consideration is, if you're looking at the temperature impact relationships in multiple regions, how do they actually compare? So I mentioned this previously, but do they make sense? If your regional relationships are slightly different, does that make sense? So, for example, the London relationship compared to the relationship observed in the Northeast, does that actually make sense? London, we generally see higher temperatures than in the Northeast. Therefore, you might expect the relationship to display that. And the third consideration is, what will actually be useful to the end user? So will actually increased granularity of a warning actually be of benefit to the user? Or will it actually cause more confusion about where they need to push their resources in the acute phase? So another example is perhaps a area that is quite large in terms of the local authority who will be managing the local response. If you're telling them it's one area within their patch, will that help them focus their response? Or if the exposure is so distributed, will that make any sense anyway, or any difference? So these are just some considerations that might need to be thought through. So these are just some of the considerations around data availability for both exposures and health impacts, and some of those wider considerations. There are other issues that are also important that may influence both the impact and exposure, and they need to be considered. But it's important to remember that they may not actually fall within data sets, and you may need to rely on expert opinion, expert judgment, and experience. This third point, just because data may be available, it may not provide you with the information you need, it's kind of a key one. If just because you have the data doesn't mean you should use it if it's not going to add anything to making something happen. And then finally, everything that we've kind of discussed will kind of depend on the main aim of the system. So in the first lecture, one of the first slides is asking, what is the purpose of a weather warning system? And we've moved into thinking about heat and health. So that's great, but if it's for the public, if it's for something to go across the wider system, or is it just for health system usage or healthcare sector, there are different requirements and different needs, and everything that we've discussed will be influenced by that key consideration. So we'll leave that section there and come back for lecture 3, which is all about working together in partnerships to actually set these thresholds.